morning, Dr. Richard Buckley here and team at MilfordMD, and thank you for watching. So, we pretty much in the procedure room every day, but we don't always post something every day because sometimes we're just too busy or not in the mood or whatever, but we have a little time today and thought we would post this, and our patient said, sure, that sounds great. By the way, what did you just tell me? You were delirious, what did you say?
I'm deliriously happy.
Okay, our patient is obviously awake, she's talking, obviously comfortable, and she said she is deliriously happy. And I would say that certainly can be the case, if people are doing something, whatever it might be, that is consistent with the consequences they desire, whether it's more education or starting some exercise program or whatever it is. If one is behaving in a manner consistent with those consequences that one desires, one can feel very good about that. Or in the case of this morning's patient, deliriously happy. Yeah, she's laughing. A wide awake, laughing patient. I prefer this to a knocked out patient. And with all of the things we do, we can always use local anesthesia. So we have infiltrated some fluids in here, and that's what's leaking out through my little poke hole here. We've infiltrated some fluids, and the abdomen is very nicely numbed, and our patient will not care what I do with it. And what I will do with it is what she asked me to do with it. So there's some lumpiness, some bits of fat here and there. Most importantly, there's some skin that when she stands up, sags down, and she doesn't want that sagging skin. Mini abdominoplasty is sort of about like so, obviously a little different in width depending upon the size of the person. If we make it extended a little more, funny enough, it's called an extended mini abdominoplasty. And an extended mini abdominoplasty, or one of our patients said it's a tummy tuck obviously, but she said it's a tummy plasty, so we could go there, we could make a new word, a tummy plasty. Can extend it sometimes as might be desirable to accomplish some lifting of the body on the side. So there's body lifting, side lifting, which can be incorporated into that. A good percentage of the time we're able just to remove some bit of skin down here on the bottom and put it together and advance the upper tissues inward, which helps to sculpt the abdomen. Some people would benefit from a so-called traditional abdominoplasty, which is bigger incision and cut way up above the belly button here. They have to cut the belly button, move it up, and pull all that skin down. You need to have way more skin laxity than our patient does in order for that to be the appropriate procedure for you. And yeah, I think probably that procedure is best done under some general anesthesia in a hospital setting. So we don't do the traditional tucks that people have, hanging skin that's way hanging down. Now, sometimes we just do liposculpting. Sometimes we do liposculpting and some trimming of skin. Sometimes we do and so all abdominoplasties are lipo-abdominoplasties. There's always a liposuction component to the abdominoplasty. Sometimes we do some tightening at the same time that we're doing the abdominoplasty. Now, I wouldn't really like to do that with the lasers we have. We have 7, for example, Smart Lipo Triplex, but that laser has one of the benefits. Sure, it tightens skin, it does melt fat, that's all fine, but it also kind of seals up blood vessels as it goes. With today's procedure, I don't want to seal up any blood vessels, and we don't need to seal up any blood vessels because we're not doing anything, we're not cutting them. And I would prefer the patient to have full blood supply to this edge, known as the flap, so that the healing is very nice. Well, so what does that mean? Well, it means we could use Vaser. Vaser is not laser. Laser starts with an L. Vaser starts with a V. It's like Liza Minnelli, who said it's Liza with a Z, not Lisa with an S, because Liza with a Z goes Z, not S. Or Liza with a Liza Minnelli, Z, right? Yeah, otherwise it'd be Lisa. So Vaser is ultrasound, and it will bounce the sound waves off of the fat cells and knock them off from wherever they're sticking very gently, and those fat cells actually are still alive after they've been bounced off of wherever you don't want them, and they can be used to do fat transfer, fat grafting. And my plan in a moment is going to be to suck some of these fat cells out of here very gently and put them in this bucket here. And then we're going to later use those fat cells to do fat transfer and help rejuvenate our patient's face, to help return youthful contours. For example, above the eyebrows to help elevate the brow a little bit. In the upper eyelids to help give a little more forward curvature, which is what one has in youth. In the temple hollows that tend to develop on the sides of our face. In the little indentation that's on the outer part of the eye, so the lateral canthal area. In the mid-cheek, where there are multiple fat pads that decrease, especially as estrogens go down, etc., etc. So there are just a whole lot of different areas on the face that get sculpted, and all differently. And interestingly, they're sort of little, pockets of fat, or basketballs if you want, and I can selectively inflate each of them. So when we put in something like a regular filler even, or if we're doing fat transfer, it's not just sort of willy-nilly, a whole bunch of fat under the skin and call it a day. It's not that way. Each little individual area has a little container underneath the skin in the fat where other fat would like to go to help augment the volume. All right, so we've numbed it. I'm going to suck out some fat to reuse. I'm also then going to vaser to help contour, smooth, get some tightening. Then we're going to remove this little piece of skin and sew things up so they're going to be tighter. And then we're going to be done with this area. Oh, and I didn't mention, we're also going to put fat in the back of our patient's hands. With time, we lose volume and things, they become shrunken, and then we start seeing, what's underneath more easily. If there's less of the tissue between the skin and the thing that's underneath, in other words, skin's thinner, the fat layer underneath is maybe thinner, and then what? Then we start seeing tendons and bones, and then what? Are you looking older? So what do? Well, we reverse that. We put some fat just underneath the skin in an artistic manner. Oh my gosh, looks 15, 20 years younger, kind of that fast. My experience with fat in the hands is it lasts and it lasts and it lasts like lots of years. We have done fat transfer for patients, well over 10 years ago into the hands, and it still appears to be holding up. I would say, maybe even almost 100%, if not 100%, which is pretty amazing. Yeah. So thank you for watching this episode of MilfordMD, and I will probably come back a little bit later and maybe show you some of that fat transfer. Thank you for watching.